planning actually preparing for the WBA system actually, right? So it's your floor. I'll give you the floor now to talk a little bit about the WBA system. To the other doctors can also have some idea on that one actually. Yes.
Yeah, so the thing is, I'm here. I'm in the Australia since last 2 years. I'm working as a ICU registrar here in the Queensland. So when I started, I came through the sort of specialist pathway here. I did 1 year of my ICU, and then I joined your class for AMC1. So I've given AMC1 after coming here, and thanks to you, I cleared it in first attempt.
Those are good. Those are supposed to clear. Actually, I just came in between.
No, I mean, I actually didn't have any idea what was the AMC one was. So
No
I
worries.
followed all your recordings and all.
No worries.
So I cleared it just before the COVID, and I was about to give my clinical, but this COVID thing happened and I couldn't give my exam. But there is something other option which we can skip the AMC clinical and give, and still we can get a general registration. So that is called work-based assessment.
Yeah.
So there are some hospitals in the Australia which are registered for the work-based assessment. So you have to work in those hospitals for 1 year, but in meanwhile you have still clear exams. So basically there will be 18 stations which you have been assessed over 1 year of period. That will include your medicine, your emergency medicine, obs and gynae, psychiatry, surgery, and one more thing, and pediatrics. So in every subject, you have to give the 3 exams. One is a case-based discussion. So the case-based discussion is you have to present a proper case starting from history, everything like investigation, management, and like whatever we are giving in the med school, the proper long case. So you have to discuss that with the consultant. So that is called the case-based discussion. And others exam is called a mini clinical examination. So mini clinical examination, they will assess, they'll tell you just to go, they'll tell you to do some physical examination or just do the history taking or just do the counseling. So like our AMC clinical. But the thing is, same as AMC clinical, we don't know what exactly the cases are. In terms of CBD, we can get the case, like we can get and present it. But in mini clinical examination, you just have to show yourself up and ask, like, do you have any case for me? And like, just I did one last week. I went to the emergency department and I asked one of my consultant, like, is there any case for me so that I can do some mini clinical examination? So he asked me to take some history about the head injury. So I took that history in front of him and presented to him, and he passed me. So that is also one of the, other, other option of getting general registration. But disadvantage is it's quite long thing. So you have to work in that hospital in 1 year. Secondly, there are very limited hospitals in the Australia which are registered for the work-based assessment. Like in Queensland,
is it 6? 6 or 8? Is it like that? Hospitals they give WBA.
Yeah, it's hardly I think 6 or 8, and some of them are coming up, but that might take some time.
Mm-hmm.
So this is all about work-based assessment.
In short, actually, yeah.
And now, sorry for my apologies that I didn't show up in previous classes because
no, that's okay. No, you are going through different plans. No, I thought like at least you should come. People will also get to know more ideas and information and encouragements and everything. WBA, Dr. Kaihan, you can just go to the AMC website. There the hospital lists names are given there. Actually, Monash is one of them. Monash is only central hospital. All others are periphery. Just for all are periphery hospital except for the Monash actually that I know. Yeah. So
sir, may I ask a question, please?
Yeah, sure.
Yeah, my question is to Dr. Renuka. Hi, Dr. Renuka.
Hi.
Hey, this is Dr. Afsha Kazi here. Actually, I wanted to ask about this WBA. Can we apply? We have to apply it from our home country, as for example, I'm in India right now. So how are we supposed to apply that?
No, so that is also one trick there. So you can't apply directly from your home country. You have to work in the hospital in the Australia for 1 year, and then you can apply, because they will always count the previous experience of working in the Australia.
Okay.
So you have to work here, and then you can apply for the WBA.
Bad luck, dear. Sorry, but
then what is the use of this WBA if you're already working over there in Australia and planning for?
Yeah, to get my general registration.
General registration.
Ah, okay. Okay, for general registration. Yeah. Okay.
I mean, by the time you will enter, you will see that, you know, she will be inside Central Melbourne Hospital or Sydney Hospital when she will be done with her. When she will be done.
I hope.
Don't worry.
Yeah.
Actually,
Thank you. Thank you. Good luck.
Because see, guys, in Australia, whatever it is, eventually, I mean, you need the general registration. Whatever it is, you want to secure PR, you want to do this, do that, you know, come under all the umbrella and the thing, the facilities, features. You need general registration. Even you want to do post graduation, whatever it is, in future, you need the general registration. Yeah, that's the thing. Yeah. Okay. Is any other has any question? I mean, for Dr. Renuka, actually. Yeah, so she's doing well. I mean, good luck to her, actually. Thank you for coming.
Hello, Dr. Renuka. May I ask you a question, please?
Sure, yeah.
Yeah, sorry to interrupt you, sir.
You can turn on your video, Dr. Faiza. I mean, we all are here like a family, don't worry. It looks more actually, yeah, I mean, connecting than, yeah. Yes.
Okay, so my question was to Dr. Renuka, actually. I wanted to ask you, if you don't mind, I mean, how did you manage to get a job within Australia without part 1 or part 2? Can you share your experience a bit?
Yeah, so probably, I mean, I have a background of, so basically I'm from India. I have done my post-graduation in anesthesia. Then I have done 2 years of fellowship in cardiac anesthesia. And then I've done 1 year of ICU fellowship as well. So probably that experience they might have counted. And that's the reason, I mean, yeah, that's the reason they might have taken me in the ICU. So there is something called a specialist pathway. You have to apply through the specialist pathway.
It's a lot.
Yeah. I mean, there are lot of options if you want to go, if you want to come in the Australia. So yeah, you have to, you know, see each and everywhere you can apply and then just go about it.
I know at least, I mean, 40 plus, I mean, doctors, I mean, just from India, actually. So they all are currently working. Yeah, so I mean, you guys are, I mean, you know, some cases planning is important, actually. You know what I saw, even that time I was in Australia, like few I know, they're neonatologists, few are working in ICU, few, I mean, so ICU is a very, I mean, good plus point. I mean, 1 degree, certain experience. I mean, if you have a degree.
Yeah, one more suggestion. Sorry to interrupt you. One more suggestion. If you want to get a job, apply in the emergency, you know, whenever the emergency department, because they have more vacancies for you rather than the other one. If you want to go for, you know, the office job like 8 to 5, no, it's all occupied by other people. It's mainly the emergency thing like ICU, ED or neonatology. Yeah. Where you have to do a lot of nights and emergency shifts. So all jobs are available here. So once you are in the system, you will get to know the system, how the things are, and then you can find your own path here. So, yeah.
Yeah, thank you.
And also, you know, I keep telling them, the people, like, you know, some people, you know, we can understand they got married and, you know, they quickly want to migrate to, I mean, to Australia as soon as possible. But often the major issues happen with some of the people, their CV is very new. I mean, just, you know, just fresh graduate. I mean, so some cases the problem happens with that because there is nothing in the CV. So they keep trying with CPD, keep trying with a lot of things. So I told them, you know, at least if you want to do something, at least 1 year, 2 year in the home country, if you have some experience, then come here. Even if you don't secure the job, you can finish MC1, then MC2, then you can keep applying for the job. So that's another way actually, like, you know, as I say, like, eventually people look forward to registration. Once you have registration, you know, a lot of doors are open for you. Yeah. So that's the thing actually. And not everyone has the capability of applying the specialist pathway or short-term specialist pathway. Your pathway was short-term, it was Dr.
Yeah, mine initially, initially I
short-term
applied
specialist, yeah, short-term specialist, SP, short-term specialist pathway. So you can also check that one, Dr. Faiza. There is a video in my YouTube. I mean, specialist pathway. I also talked about the short-term specialist pathway actually, but you have to be specialist in a certain way actually. That's the thing. Yeah. So don't worry. I mean, just keep trying, guys. I mean, it's not like I was checking one of the doctors. I mean, because I've been dealing with since 2017. So those doctors were there in 2017. I was checking the list. Almost 85% of them are working now. Yeah. There are only few are not working, and the reason behind that one is actually a huge gap. Like, you know, because I mean, see, 2017, that means they have been passed MC1 that time. Some went for 2018 for MC Clinical, some cleared it. After that thing happened, some in the normal process, they get into job, finishing MC1, finishing MC2, then get into process in Australia as they did. And some of them, they just pass MC1, they just sit in the same place. Yeah, we do consider now, especially sometimes on the, you know, female person, like kids, childbirth, this thing processes came in between. And, you know, the clinical gap processes becomes more long in that case. So, and, you know, by this time they already inside Australia. So inside Australia, it can be beneficial for you, but at the same time, living inside Australia can be harmful for you as well if you are not working. Now, it's very beneficial, you know, it becomes beneficial for Dr. Ranuk actually. She was inside Australia, so she could apply for the WBA system or any other thing she can apply. I mean, since she's in the system actually, right? So that's the plan actually. That's, I mean, make a good plan, guys. I mean, and don't worry about the AMC clinical. Sooner or later it will start actually. We all have gone through tough time. I was stuck for 6 months in Australia. Now I came to country. My wife got scholarship. She went to Norway. You know, see, you know, this COVID things are, you know, having lot plus minus nowadays in life actually. Yeah. So, and now I also cannot go to Norway because border have been closed by the Norway government actually. So, you know, so look, tough time everyone is going through. So we can just wait, hope, pray, and things will be, and keep yourself prepared for when the MC clinical starts. It doesn't mean that everyone passes MC clinical in one go. So make yourself that good that when it starts, that's so that you pass in one go.
Yeah, I mean, just want to share because
Yeah.
my husband has also given AMC clinical, but he couldn't clear it. And he was like, no, I'm not going to give it anymore because it's quite frustrating. And COVID came, so that turned out to be lucky for him. And then both of us got a WBA. So AMC clinical is a difficult thing, and you need a lot of practice for that, that's sure. And yeah, you are doing a great job, Dr. Shariar.
No, thank you so much. Yeah, let's see. I mean, MC clinical, I haven't given big emphasis like MCQ before, but this time more serious with the setup and the things. And let's just hope things will work this time actually. Yeah. No worries. Thank you. Thanks for your good wishes. And yeah. All right. So thank you, so Dr. Renuka, for wonderful session. I guess, you know, so it was very helpful. Okay, guys, who's next actually? You know, anyone who wants to come next? Anyone who wants to come next?